A beautiful young girl undergoing a simple surgery, in a flash, is left horribly scarred.
I remember my dad just crying.
The day before, Lauren Wargo was a vibrant 20-year-old college student home for winter break, getting some irregular moles removed.
I heard the nurses telling my parents that there had been an accident.
The accident was a surgical fire. Lauren's parents were told she suffered the equivalent of a bad sunburn and her doctor sent her home. But her parents were horrified when they removed the bandages and discovered severe burns over more than half of her face.
I kind of asked her if my eyebrow was still there, and she said that that was going to be the least of my problems.
Both eyes swollen shut, with large blisters hanging from her skin, Lauren was rushed to Metro Health Medical Center's burn unit.
They had to remove the dead tissue and I had charred skin on my face.
The excruciatingly painful scraping and cleansing procedure was necessary 3 times a day for several weeks.
The burn center had recommended that I didn't look at my face right away. I was worried that I wasn't going to have the kind of life that I had before.
Fire!
Her parents then learned she was injured in a surgical fire.
They can be caused by a number of different things.
Dr. Wael Barsoon, chairman of surgical operations at the Cleveland Clinic, sat down with us to discuss surgical fires, even though Lauren's injuries did not occur at any Cleveland Clinic facility. He says across the country, surgical fires happen an estimated 550 to 650 times each year. Some are small sparks, as seen in this training video, while others are severe enough to cause disfigurement and even death.
And it really is heartbreaking when we see an incident.
Dr. Barsoon says there are 3 consistent elements in the fire triangle.
It's a good environment for a fire because you have high levels of oxygen, and many folks use disinfectants, to sterilize the skin that are high in alcohol.
And finally, a spark or ignition source.
So one of the tools that we use very commonly in an operating room is a cautery device to stop bleeding, and that obviously can create sparks.
After 9 fires occurred over an 18-month time period at the Cleveland Clinic, they took a proactive approach and increased training for all surgical personnel. They also stopped using alcohol preps altogether.
We've decreased our rate of OR fires by 80%. When I say we had fires, again, there was not a flame. We had a spark, or we had a smoke from an electrical outlet.
The Cleveland Clinic is open and transparent about their fires, but they don't have to report anything by law. Some states track surgical fires, but Ohio doesn't. In fact, neither the Department of Health or Hospital Association would even talk about it on camera.
We didn't really find out exactly what happened to me until my case went to trial.
Lauren sued plastic surgeon Dr. Brian Michelow and won a large verdict. According to court transcripts, during the surgery, despite knowing that Lauren was receiving oxygen through a mask, Dr. Michelow activated the Bovie cautery device near Lauren's forehead without first ensuring the oxygen had been turned off, and fire erupted. The decision was overturned by the Court of Appeals, and Dr. Michelow was granted a new trial. His attorney says since the case is still pending, while Dr. Michelow is awaiting the new trial, he is not at liberty to discuss the facts of this case at this time.
It's scary to think that just a lack of communication in an operating room can affect someone's life as much as my life has been affected by this.
In October 2011, the FDA released a safety communication to all healthcare professionals with detailed information on preventing surgical fires, including something as simple as taking a timeout so that the alcohol can dissipate. Lauren's working with the nonprofit group surgicalfire.org, trying to get those FDA recommendations implemented at all hospitals. Although the Cleveland Clinic was not involved in Lauren's fire, Dr. Barsoon says they do support her hard work.
The reality of it is it's a complicated problem, and it is a high-risk environment, and we do have to really all help each other to ensure that these types of problems don't jeopardize our patients.
As for Lauren, who is now 25, she's still healing, but there is permanent scarring. Her left eye doesn't close all the way and is prone to infection. She did graduate college, but every day is still a struggle.
Everybody was still kind of wondering, am I ever going to get over this? And I guess the answer is no, but I've come so far since then that I'm definitely lucky.
In Cleveland, Suzanne Stratford, Fox 8 News.